Overall, I can report good news over the short term and progress over the long term. Our case counts are falling in Philadelphia and around us, and our severe outcomes are falling over the long term. Here are the numbers. Since this time yesterday, we've identified 145 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 31,584 since the beginning of the epidemic. Now, for the past week that ended last Saturday, August 8th, we averaged about 105 cases per day. So that 145 is a little higher than that, but it fluctuates a lot day to day. Our oral numbers are down. That 105 cases per day is compared to 123 cases per day the week before that, and 166 cases per day the week before that. Now, our new cases are still predominantly younger people. 59% of the cases reported today are under the age of 40. And we have no evidence of a delayed increase in the number of cases in older people after the increase in our total case counts we saw in late July. Now, also last week, we averaged 4.1% of the people who were tested for this infection being positive. That 4.1% positive is the lowest percent positivity we've seen yet. It was 4.8% the week before that, and that was the first time we had ever been below 5%. Now, we've been reporting these case counts for the last 5 months. As the mayor said, the first case was reported in Philadelphia on March 10th. Since then, at these press conferences, I've mainly focused on the number of cases that we see each day, and that is important. But remember that most infections cause either no symptoms or mild symptoms. So what matters most are the severe outcomes, such as infections in people in nursing homes, hospitalizations, and deaths. Our website shows data on the severe outcomes. And as of a couple of days ago, we have an option where you can show the numbers by week, which give you a better sense of the overall progress we've made over the last 5 months. So for example, if you look at the number of people admitted to hospitals, newly admitted per week, it was more than 800 at the peak in mid-April. And in late July, it was less than 100. As far as nursing home cases, in the last week, we had only 4 cases, many of which were identified through screening of asymptomatic residents. That's down from 750 cases at the peak week in April. Now on to deaths. We have 1 additional death to report today, bringing us to the total of 1,700 deaths since the beginning of the epidemic. But to put that in perspective, at the peak week in mid-April, we had 250 deaths in a single week. In the last week of July, starting July 26th, we had 8 deaths. So far in August, we've only identified 2 deaths. Now, typically there's a delay in hearing about some deaths, so we'll learn about some later. But the fact that we're talking about 1 or 2 over an entire week is a sign of how far we have come. No death is acceptable, but we're getting down to 0. That's a very big sign of progress. Now, where are we with testing? We still have long delays in people getting their test results reported to them from some laboratories, particularly a laboratory called Quest. It does about 12% of the testing in the city of Philadelphia. We have seen improvement in delays in turnaround from other laboratories, particularly another big laboratory, Lab Corporation, was averaging about a 7-day turnaround. Now they're averaging about a 2-day turnaround. So that's progress. Contact tracing is still going on. We have a large team that's doing this work. I'm going to give an update on Thursday of the data from contact tracing for last week when our numbers are more complete, because it takes a few days for the work to play out after we initially hear about a case. That's what's happening in Philadelphia. Around the rest of the region and the state of Pennsylvania, case counts are also falling over the past 2 weeks. And in the United States as a whole, case counts are quite high, nearly 50,000 cases per day in the nation as a whole, but they are declining, falling about 18% over the past 2 weeks, according to data compiled by the New York Times. So I can't say how long this will last, but as of today, all the trends of this are in the right direction. All the trends are good. Which then brings me to how we maintain that. The most important thing people should take from this is we need to continue to wear masks. It's more important now than ever. We want to maintain this momentum. We don't want to go backward. So if there's one thing that people should do, it's commit to wearing a mask when you're around others. It's especially important as we approach the reopening of colleges and universities and the reopening in class of some schools. It's important for students, it's important for teachers in those colleges and in those schools, and it's important for everybody else. Finally, let me just remind people that there really is an extra risk for people who are medically vulnerable to this infection. That would be people over the age of 65 or people who have chronic medical conditions. best for people in those categories to stay home. Avoid contact without masks, even with your relatives and caregivers who are out and about. If they're out, they might very well be carrying this infection and not know it. So if you're around your relatives and caregivers, make sure they're wearing a mask and you're wearing a mask. We will be trying to identify as many people as possible and get the right messages to them who have these medical conditions and are living at home. So as of this week, we'll be sending a postcard to some 14,000 people we believe are high-risk residents in Philadelphia with the information that they should stay home and phone numbers about support that they may need in order to do that. So that's the update for today. If you want more information, just go to our website, www.phila.gov/COVID. Thanks.
Person. And also, please remember, we do have a limited time during these briefings, so only one representative from each outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able. And we will now unmute reporters one by one, starting with Mitch Blocker of NBC 10. Mitch.
Good afternoon. Dr. Farley, I have a couple of questions for you about your meeting with Dr. Birx's task force. I'm curious what you expect from the meeting as it goes on this afternoon and tomorrow and Thursday.
So background for other people, there is a group of federal workers who are from Health and Human Services who are here doing a site visit. They've been doing site visits for cities around the country, and Philadelphia is one that they've requested. They'll be here today, tomorrow, and Thursday. This is really an opportunity for them to see our prevention work. And so we are talking to them about all the different aspects of our work, from testing to contact tracing to social distancing to protecting vulnerable populations. It's an opportunity for us also to tell them what the federal government can do for us that could be helpful. We've spoken to them about the need to solve the testing problem. These long delays are really very problematic for us. We talked about the need for really thoughtful planning right now about how we deploy a vaccine when it comes around. So this is really more of a conversation between different levels of government about how we jointly do things better.
Well, is there advice that you plan to give them about what has been successful in Philadelphia, and also what exactly have they said when you've addressed the testing inadequacy?
They recognize it's a problem, that they will take that information back. These are not people who can solve that problem, but they can at least deliver that message to other people in the federal government. I'm sorry, the first half of your question was?
Oh, I guess I'm curious what lessons your team has learned that you think other American cities might benefit from.
I think they might have a better perspective on that than us. I know what we're doing, and I'm pleased with the effort we put in place here, but I haven't compared. I don't know too much about the details about what other cities are doing to know how we compare to other cities, and maybe they can provide some of that information to us.
Well, the question I'm asking is, what advice would you give to the task force to communicate to other cities that might be helpful?
Again, because I don't know where the other cities are, the main advice we're giving to the task force is what the federal government can do. These are people who understand how the federal government works. They're not necessarily local public health experts, and there are different approaches. And so I mainly want to take this as an opportunity to emphasize what the federal government can do to help. I do think, testing has been a problem since the beginning of this thing 5 months ago. It's not good that we're 5 months in and we still have that problem. And so I really want them to solve that.
In regards to 14,000 vulnerable residents that will be contacted by sending them the postcard, I would like to know how they were identified. Were they identified by race or age?
So the federal government, through the Medicare program, has information about what residents of Philadelphia are receiving payment for durable medical equipment. That could be home oxygen. It could be other supplies that someone who has a chronic medical condition needs at home. That is not a perfect marker, but a pretty good marker that these people have chronic medical conditions. So we have their address. We don't have anything else that I'm aware of beyond that. So they were not chosen by age or race. They were just chosen by their medical vulnerability. Now, by virtue of the fact that this was Medicare, most of those people are going to be over the age of 65. but that's how they were identified.
Second question is, what's exactly contained in this postcard sending to these people, and what are they being told in it?
They're being told the same information I just gave here, that they, if they're over the age of 65 or they have a chronic medical condition, they should stay home so they can stay safe. The people around them should wear a mask. And then there's phone numbers that they can call and websites that people can get more information.
Dr. Farley, on social media, the actress Alyssa Milano has said that her hair is falling out as a result of having COVID. And apparently there's some other people that are complaining of a similar symptom. She says that she had the long haul type, disease. Is that a possible side effect of having COVID? Does that seem unreasonable? Is it likely? And maybe just talk a little bit about these long haulers and the other symptoms that might come along with it.
I have not heard of hair falling out as being a symptom of COVID. I would think it would be unlikely, but this is a new virus. We're always learning things from it, and so I can't say it's impossible. I'm not quite sure what you say by long haul, but certainly some people have a prolonged course. Some people can be in a hospital on a ventilator for a long time. If you're sick for a long time, in general, that's going to make you weaker, more debilitated. You're going to lose weight and be weak as a result of that. And there may be a lot of complications from that. Could hair falling out be part of that? Perhaps. Again, I think that the key message is that this is still a new virus. We're still learning from it. But the most severe outcomes I think we know about.
Dr. Farley, there was an article today at the Washington Post that talked about the net gatherers versus N95 mask or even the surgical type of mask. Can you explain why the net gatherers aren't really, actually the quote was, net gatherers are worse than no mask at all?
I think that's pronounced Gaiters, but I did not see the article. I have not seen any research on this. So, what a Gaiter is a piece of cloth that goes around your neck, and then you can use it to cover your nose and mouth. I would think that anything that's a cloth mask that's covering your nose and mouth should be helpful. In general, the tighter the weave, the more protective they are, because then more of the droplets are going to be filtered out. So if you are wearing a gaiter that has a very loose weave, and maybe some of them are, then it wouldn't be terribly helpful. But still, anything is going to be better than nothing. I think that, it'd be better for people to wear a mask, but I still, the most important thing is just wear a mask that you're going to be comfortable wearing.
One of the things that was talked about in the article was that the porousness that you spoke about, the droplets actually get through the mask a lot easier than any other mask they tested. And so there was also something quoted in there about 3-layer masks. And the reason why we're talking about this is because these masks become expensive. And so we're just trying to figure out exactly for Philadelphians that may be experiencing financial insecurity, what's the best option when covering their face?
Yeah. So we'll tell you what, the short answer is let us research a little bit about mask, sort of quality of materials and sort of get back to you in a future one. But if people are asking what mask I wear and what mask I recommend, is this one here, which I bought at pharmacy. It was $8 for a pack of 10. And, I can wear this for a week and it's still in pretty good shape. This is, it's a paper mask with it. It's multiple ply. We know that filters out an awful lot of viral particles. And so, there is some cost to this, but it's not a huge cost.
Hi, my question's for Dr. Farley. I was wondering, what's the declining number of cases and the declining % positive rate mean for the possibility of indoor dining on September 1st? And if the numbers continue to decline at the current rate, would that put the city in a position to give that green light next month?
Well, one thing I've learned to do is to not predict what's going to happen because the virus is full of surprises. I'll simply say what we said is that indoor dining cannot start before September 1st. It might start on September 1st if the numbers continue to look good. But there's still a little bit of time before September 1st to find out whether the numbers will continue to look good.
Okay. And in terms of the numbers looking good, what would be your ideal threshold for, I know you say all the time that there's a variety of numbers, but what would be the threshold that we'd have to meet to get there?
Well, we have metrics that we've laid out for going to green on our website, and we laid out there we wanted the daily case counts to be below 80 per day, or the percent positive below 4%, and we want to see a steady decline for at least 4 weeks. And there are other metrics there as well, most of which we've already met.
Is there any plans to incorporate antigen tests, I guess either antigen or rapid antigen tests into Philadelphia testing sites? Is that something that the city is looking at?
So for those people who don't know, there are rapid tests that are done that are a different sort of technology. The main tests I'm talking about here are called PCR technology. Antigen tests have the advantage that they can be done very quickly. So you can get a response right away, and they're not dependent on complicated chemicals that need to go to a separate laboratory. The downside is that most antigen tests that I've seen have a major problem with false negatives. Maybe as many as 30% could be false negatives. And there may even be false positives, as you know, with the governor of Ohio. And so any testing site that wants to can try to procure these machines in order to do this antigen test. And so there probably will be more of them doing that. We are not actively promoting it right now at the city level right now because of our concerns about the accuracy of the test. If there's an antigen test that comes out in the future where there's evidence that they're much more accurate, then we'll be much more enthusiastic about promoting them.
So the Governor Wolf issued his guidance on the schools, and it says any county with substantial transmission must do all virtual. And then the Department of Health's website says Philadelphia has moderate transmission, yet the city's website says they have high transmission. Which are you guys going?
Yeah, we fall, and according to the governor's criteria, we fall in that middle category where the governor is recommending either blended instruction, which would include some in class and some virtual, or all virtual. It's our position that schools still can open in Philadelphia safely with a variety of safety measures, and so the blended option is something that they can choose to do. The public school system, School District of Philadelphia, has opted to go all virtual to start, and other school systems in the city are still working out what they'll do. But we feel that it can be done, and it can be done also within the governor's guidelines.